Um, Welcome, everybody. My name is Robert Vincent. I am the Associate Administrator for Alcohol Prevention and Treatment Policy here at SAMHSA in the Center of Substance Abuse Prevention. And I would just like to say thank you to the National Federation of Families for inviting us to participate in today's session. I would also like to introduce my two colleagues, Erin Wick, who is the Senior Director from the Capital Regional Educational Service District 113 in Washington State, and Debbie Berndt, who is the Director of Parent Movement 2.0, and each of them will introduce their background for you today before we get started. Erin, would you like to lead off?
Sure. Good morning. Welcome. Happy Friday. Erin Wick, Senior Director at Capital Region ESD 113 in Washington State. There are 9 educational service districts in the state of Washington. We're one of those. We serve 44 school districts, 1 tribal compact school, reaching about 73,000 students in our region. We are a licensed behavioral health treatment agency for both substance abuse and mental health. And our model is a comprehensive student assistance model serving prevention through recovery support. Thanks for having us today.
Hi, my name is Debbie Berndt. Hopefully you're seeing me okay. I do run an organization called Parent Movement 2.0, which is focused on parent education. I am a parent myself. I have 3 kids that span 8 years. So I have officially been parenting high school and middle school for the last 12 of those years. And we find that parents really are the front line of substance use and all that it entails, and need a lot of information and a lot of support and a lot of permission to lean into that role. And so I was lucky enough to meet Rob and find out and start working with the Talk They Hear You campaign. I'm not even sure how long it's been now. It's quite a while. And just really think this is a great program, and I'm excited to be here with you all today.
Well, and thank the both of you. And so for our participants today, of course, our focus is on families, and we're going to be talking about collaboration and integration in implementing substance use prevention and early intervention programs for parents, schools, and communities. And while our focus today will be on Parent Night Out and some of the work done there, of course, anytime you're having these conversations, you can't help but they spill over, because the topic is so broad and so much more complex than as simple as any one of us might just sort of imagine. We like it all to be simple, but rarely is that the case. So about Talk They Hear You. Talk They Hear You is a multifaceted national media campaign that really works to align the public health messaging with the national media campaign, and then run a through line through to the individual participants, meaning parents, caregivers, schools, and communities. The campaign got its inception at 2013 and has been evolving every year since. In the last couple of years, we've been really focused on student assistance programming and the kinds of things that we could do there to really help our school partners and our community partners who are doing work in schools have a better and more opportune circumstance to work with kids in a more effective way. We'll talk a little bit about some of the implementation of various aspects of Talk They Hear You, but in particular, we'll talk about Parent Night Out, and that will naturally creep over into some of the student assistance work, especially during these challenging times when many of you have had to be rethinking either how my child, from the parent caregiver perspective, how we're going to re-enter school this year, what accommodations do I need to make there, all of the other questions that every parent is asking, of course. And then if you happen to be school staff and faculty, what does that look like? And in the case for Erin and others, if you happen to be a provider in the school, what kind of accommodations and what do you need to be thinking about there? So all of this sort of swirls into the big soup that parents and schools are often dealing with, as well as communities, as we all come back together during these challenging times. We'll talk a little bit about overview of Parents Night Out and talk about some of the implementation of Parents Night Out, some of the things that have worked and some of the things that have not worked. Apologies for that. Somebody decided to call me during this session. That's always nice. And I did not go in manner mode. My apologies yet one more time. Hopefully they won't continue to call back. We're going to talk about the purpose of Parents' Night Out, what those resources are that are available to communities, some of the best practices for implementation. As I said earlier, we've run a couple of pilots. Both Debbie and Erin have both been pilot sites in the Parent Night Out and have helped us shape that particular intervention greatly for us. And so you'll get a chance to ask them questions about their implementation, talk about how it's gone, and then we'll ask you, of course, to consider a little bit of that at your end as well. Want to discuss how local community groups and coalitions have integrated Talk to Hear You into their prevention efforts. The campaign is multifaceted and rather broad, so we'll talk a little briefly about some of those pieces. And then, of course, we'll have questions and closing remarks for today. So let me get us into, I talked a little bit about Talk to Hear You as a multifaceted, but it really starts as parent-focused national media campaign. And I think today we're something on the order of about 400 products that have been developed within the campaign for local schools, coalitions, and parents and caregivers. The tools really are to help parents and caregivers primarily have a conversation with their child. We often refer to our efforts as trying to help parents and caregivers who have said to us repeatedly over the years that not everybody feels entirely comfortable with having these conversations with their child. And in many cases, many of them would want to have what I refer to as the one big talk. And many of us have probably either experienced that personally or given the one big talk. And in many cases, we've probably observed that, you know, the thing that happens most frequently is the child is probably doing their level best to figure out a way out of the room. And the parent and caregiver is probably going, am I doing this right? Can I do this differently? And they're probably equally as scared about having the conversation in some cases. So the whole goal here is to help parents and caregivers get prepared, or I'm sorry, get informed, be prepared, and to take action. And we do that through a number of tools, and we'll go through some of those today. So for the most part, many of you may be aware of this, but just in case you aren't, you know, alcohol remains the #1 substance of use for young people. Now, I'm forecasting in the next, 2 or 3 years, that may change a little bit given the efforts around cannabis policy and some of those things. I suspect we're going to see an uptick there. But it affects nearly 1 in 14 people over the age of 12 in the United States. In fact, it's about a $249 billion problem in our system, just to put a fine point on that. Alcohol and substance use during the teen years is known to interfere with normal brain development and of course, increase the risk of developing a substance use disorder. We know that there are harmful effects related to alcohol in that capacity. And we also know that the longer we can delay the early use of alcohol or other substances for that matter, but in particular alcohol, the less likely they are to develop an alcohol use disorder or another substance use disorder. Injury and violence related to substance use is one of the leading causes for teenage death. And it really results in about 3,500 deaths a year as it relates to that. And so when you think about the causation of things and some of the harmful effects, this is one of them as it relates to alcohol in particular. But it's also true for other substances, unintentional accidents and the like that way. So I talked to you a little bit about the campaign. I want to just sort of drill into the goals and some of the things that we've learned about that and really what the focus of the entire campaign, regardless who's speaking. And when I say that, because we focus on parents, caregivers, schools, and community, we know that all three of those groups affect the health and well-being of a child as they're going through their developmental phase and growing up. Our particular focus is really on increasing the awareness and prevalence of those risks to underage drinking and other substance use. And it really is kind of interesting what parents, through our formative research and evaluation, parents have told us pretty consistently that many of them do not feel very or adequately prepared for this information and don't have really all the information they needed. And that's one of the reasons why the Parent Night Out campaign sort of came to be as a part of Talk to Hear You, was as we were having our conversations and trying to think through what can we do to assist parents in this particular space. That's how it came to be, is that if we could create tools that would help them practice, get that information in a non sort of, sometimes the information that we at the Fed produce is often, how do I say, very bureaucratic. We are really doing our level best with this aspect of Talk to Hear You to create really community groups and methods that allow parent-to-parent conversation or other folks in that way to talk these through, to have that conversation in a low impact kind of way. Secondly, we want to equip parents with the knowledge, skills, and confidence. And I'm just going to emphasize the idea of skills and confidence. Parents have told us pretty routinely that they don't always feel very confident about all of that. And so there are a number of tools. We'll talk about the mobile app and some of its practice that is included in the use for the Parent Night Out. But all of the tools that are developed are largely focused on how to develop skills. I mean, we provide certainly a lot of knowledge, but we're really looking for skill development and to help them have that confidence, to have that, not just one conversation, but 61-minute conversations. In fact, I might suggest many 1-minute conversations for a very long time, depending on where you start in a conversation. And it's important to note that we're often talking about starting as early as 9 in this conversation. Lastly, the thing that we're really looking for out of all the materials for both the campaign and Parent Night Out is to increase parents' actions to prevent. And when we say parents' actions, what we're really talking about is, did you have that conversation? But there are other actions that parents want to be involved in and should be involved in to help do some of that. And some of that is just simply asking questions around, I see you're spending the night over with one of your girlfriends or boyfriends or whatever that looks like as a sleepover tonight, and maybe asking questions around who's going to be there. Is there going to be other folks? Have you had conversations with the other parents to ensure that there's no drinking or other things going on? So that's a little bit about the goals of the campaign. Central to the campaign is this notion of what we refer to as the 5 conversation goals. And what we're in particular looking at is how to have a consistent message for parents and caregivers. 1, show you disapprove of underage drinking and other drug use. Not from the authoritative position of that, but that as a parent, caregiver, concerned teacher, educator, or community member, that we love and care about you and we're concerned about your health and well-being. We want you as a child to grow up to be your very best. We want you to have every opportunity to succeed that we can possibly help you do that. And that's in fact what parents, schools, and communities do with routine, is help support our children's growth and development. We want to show that you care about their health and wellness and success and all of that, and that comes through all of the different messages. Show that you're a good resource of that information about alcohol and other drugs. And for some of us, that means we have to stretch a little bit. We'll have to kind of get a little bit of new information. Show that you're paying attention. I refer to this as presence. Be present in these conversations, but be present in your community and your school. When you see a child or something going on, engage, not from the authoritarian sort of top down, we're going to discipline you mode, but I'm concerned, I care. Let's talk about this for a minute. As you well know, especially after the age of 13, young people developmentally are they're sort of off and running at that point. So it's a different conversation after that age. Build your child's skills and strategies to avoid alcohol and other substances. And sometimes what this really means is, do we give them an escape plan, right? You can either give me a text code that if I find myself in trouble, Mom, can I text for help in some sort of code or some way around that? Sometimes it's buddy systems. Sometimes it's parents or schools or community people being the screen for them to help them have an excuse not to or to do something else. Some of the other areas that we know that are very difficult for parents through this conversation is sort of answering kids' tough questions. You know, why? And it's a very simple one for most children that I think comes to mind. So why is that bad for me again? Especially if the adults around me are involved in drinking or smoking marijuana or those kinds of things. Sometimes we as parents and caregivers, school officials, sometimes I refer to it as we attempt to scare the health into them. We want to help them feel like this is urgent and you shouldn't do that, but we're going to ask you to resist that feeling. Generally, it shuts the conversation down. And so what's probably more important about that is sort of that place of concern and care. And sort of, if you will, what is often referred to in motivational interviewing, you might want to sometimes develop some discrepancy, but you want to develop some alliance with that in terms of being able to continue that conversation rather than shut it down. And, you know, some of those other odd conversations that, especially those of you with teenagers, I got invited to a party. Can I go? Okay, so this is that point in time where we ask a few extra questions and sort of be present with that, because it's easy to, especially when they get 15, 16, sort of put them on autopilot. After all, they're just little young adults, right? And their brain's fully formed. And of course, the brain research doesn't suggest as much. Really, it's about 25, 26. I think some of the boys, it might be later, but I'll just leave that alone. That executive functioning really gets sort of fully formed, and we often refer to that as the go, no go, or the stop mode around executive functioning. So let me introduce Parents Night Out. This particular version, we've got two different versions of Parents Night Out that have been developed. One is pre-pandemic, which is an in-person 3-hour session. These are 3 1-hour sessions done in a community setting inside of a school. Could be at a PTA meeting, PTO meeting. This could be any parent group in any community meeting, any number of ways that occurs. But the real goal here was to do some of what I said. We'd create a number of resources with that. Now, the additional version that we have done since the pandemic is what we're referring to as sort of the virtual version. And for many folks, this may be actually a better alternative and something that you could do with greater routine, actually, because of sort of the online methodology for delivering this. It's a 1-hour version. It's highly integrated with our mobile app and sort of Zoom friendly, if you will, and allows you to, as a facilitator, deliver it pretty easily, I think, by and large. The campaign really, at its core, was really about helping sort of in those everyday situations with this. And so that's what we're continuing to try to communicate along the line here. So let's talk a little bit about it. It's an interactive session that helps to inform, prepare, and assist parents by taking those actions and having those conversations. 1-hour led, it is facilitator led. So this isn't, just give it to a parent and they'll implement it. This is really, we're wanting a variety of folks to be facilitators. And what you'd be looking for is somebody really with more good facilitation skills. This could be a parent. This could be a school staff person. This could be a community person, say a community prevention specialist, or any number of community health workers, or just an interested person from the community that has a passion for wanting to have some of these conversations. We sort of lead off with what you say and how you say it's going to matter. Parents Night really taps into that core campaign messages that parent conversations and have all of those small ongoing conversations are important, and how you talk about it, meaning tone of voice and the tone and the context. So many of you are probably quite aware that for many of us, if you're driving in the car with your child, that oftentimes is a great place to have a conversation. But the point here is that it sort of matters what you say. And, while I think sometimes it feels like they're not listening to us. The reality is the evidence bears out that they in fact are. They just don't really acknowledge that always. In fact, rarely in the early days, but usually it comes back in a much later time to us. And while it may not seem like it, the research really does show this out. So one of the things that is of concern is treating children really more like a partner in the conversation, meaning this sort of side-by-side engagement opportunity. So that's a little bit of that particular piece. And so at this point, let me have Erin and Debbie talk a little bit about their experience. We did our pilot testing, of course, in ESD 113 and Parent Movement, and also with the National Families in Action. All three of them had a chance to do that. We have at least two of the three here, and they're different kinds of implementation in that. So I'd like to invite Erin to start, and then Debbie, if you'd like to pick up from there just a little bit.
Hi, yeah, we were super excited to get to pilot this project and work. As Rob mentioned, the original format was the 3-hour in-person, and so we were really excited to launch that in our region. And of course, due to the pandemic, we were able to be really creative and create in partnership and piloting the 1-hour virtual session. And really the timing was so critical on all of this, because as our parents and students weren't really having a lot of access with others outside, it was really important to allow our parents to have that opportunity to understand how to communicate and how to look for ways to talk with their children during this critical time. So we have been hosting this. We're going to continue to host it monthly for our region, and we've kind of opened it up to anybody that wants to participate. And so we just find it as a really great launch pad to other resources and services in the area. At the end of the session, we are able to do questions and answers and help direct families to different resources if they have friends or families that they need supports for. And so we're really enjoying the impacts that this is having in our region.
We basically had the same experience. We had 2 pilot sessions that we ran, one that was run by a coalition and the coalition leaders, and then one that was run by what I would call more of a parent ed kind of person. So someone that was coming from that school environment and was just opening it up to a school and inviting parents to come from the school. Whereas the other one was coalition led, and it was inviting parents in their area, but also there was a lot more prevention kinds of people there and systems of care kind of people there. And the thing I thought was great is that it is a really tight presentation. It is not, it's not too long, but it still feels meaty and useful. Like people are really getting some real information for committing the time to it. And it was easy for the facilitators to pick up and deliver it. So it's designed in a way you could almost not ever even look at the facilitator's guide. You could just walk through the presentation if you had any kind of experience in prevention or interest in the topic, and really get through it pretty easily. So I think the barriers to implementing is something I'm always thinking about, and this is very low barrier to implementation. And then the facilitator's guide is useful as well. It was good, and we ended up, it was a different dynamic. The coalition-led one ended up being more about implementing and expanding the program afterwards. That was the Q&A, and on the parent ed one, it ended up being more about just parent conversation. And the more we can get parents in conversation with each other, just the better.
Thanks, Debbie, and thanks, Erin. And, I wanted to just also mention here, built into the core of this is the survey feedback from parents and facilitators. And that has been instrumental in both the shaping of Parent Night Out, but also instructive, I think, for all of the facilitators, and embedded into the actual presentation of some of those core questions as well, to help folks sort of do the implementation. Parent Night Out is really, for the most part, designed designed to come alongside whatever else you're doing. It's great if you're implementing all the other parts of Talk They Hear You, but it wouldn't really matter if this is the only thing you did as well. It is really designed to be a little standalone in that capacity for folks. We are rolling it out this year, so it's sort of going into its full release at this point. So let's talk a little bit about some of the things that are included in Parents' Night Out. Some of the engaging polls to facilitate group conversations. So we're sort of trying to be interactive, especially in the virtual version. Many of us have had that experience in virtual versions where it's, you know, sort of more not as interactive as you might hope for. We're presenting the latest facts on underage drinking and other substance use from either SAMHSA's national survey. One of the things that I would also say that it's also customizable. If you happen to be a coalition within your area and you have local data on your school building or your school district or your community, this would be a place I would tell you to put that in as an additional slide. We're going to talk about the triggers for youth substance abuse. What is it that prompts all of that? And then some of those substance use trends during the COVID period, because we've seen some market increases in some things and dynamics, not only in just policy, as many of you have seen home delivery and online ordering, those kinds of things shift, but just the sheer fact that children and parents are both home and there's different dynamics in the household today than perhaps there was prior to. Also included is some of the tips for parents to how, you know, conversation starters. What are some things that I can do to get this conversation started? And those turn into large and great conversations, especially when we have a parent-led, I call it parent-to-parent version, where so many parent-to-parents are sort of commiserate the task and the job of parenting, if you will. And I think that is creates a bit of an authenticity that is quite helpful in doing this. But it's also helpful, you know, to be that parent that has had time to think through and work through some of these methods of having that conversation and how to take the edge out of it a bit. Walking through and having some of that deep conversation around some of those tips for answering tough questions and feeling free to have that conversation more broadly with that parent group. So that, you know, there may be something, a new pearl that one of us learns. And, you know, every time I've done something like this, inevitably, I learned something new that I didn't know before I went into it. I'm talking about an overview of some of the parent resources from Talk They Hear You, and there are a number of them, including the mobile app, which we'll talk a little bit about here shortly. An in-depth look at the campaign's new mobile app, and it is a new mobile app. If you've been familiar with the campaign, we've got 2 mobile apps. We just recently discontinued the older version, which was an avatar-based version, and then we're now launching the new version. It's in all 3 platforms, meaning Android, iOS, and Windows. So it's available to whatever device you have. You can use it on that device. The goal with that app is really to help you practice, get information and practice. That really is the idea here. So let's take a look at one of the video clips that goes with it. It's one of our national PSAs. But I want to just make note that we give you options for a number of video clips that could be used in this. And what we would recommend is that you select one of the video clips that would make the most sense for that particular audience. Not just using the one that we embedded in the PowerPoint here, and which is sometimes the case for folks. So let's see if the audio is going to work, and I'm hoping that'll be the case. Okay, that did not work out the way I might have wanted it to. Let's see if we're going to have a technical difficulty or. Is it never quite fails? Let's try this again.
Robert,
Yes.
when you started the original slide set, did you put on sound before uploading, before sharing the slides? That's usually the problem.
Well, what's happening now is I'm going to just say share sound. I just did that. Let me try this again. It was having more of an issue. Here we go.
I'm getting notice that there's a slow feed, so it might be the internet connection.
Yeah, I generally got good bandwidth. That's okay. We can, if it doesn't work out here in just a second, I will move it. And what I will do is send you two in the chat. The YouTube talk they hear you as we go forward. So let me just see if that's going to either go or not go. It feels like it's still trying to do something. So I'm going to see if I can just advance it from there. And of course, we had a couple of videos, so this may actually be a little bit of a challenge for us, but we'll work it out because we've got a couple of videos. And I may turn it over, and I don't know if Erin, I'll pass the baton when we get to yours, and we'll see if it'll work better at your end, maybe. So let me talk a little bit about something that Debbie had spoke to a little bit. We include a facilitator's guide that gives you some of the background on the issues of underage drinking and other substances. Information about Talk to Hear You as a campaign and its resources for parents. There's also what am I thinking here? I keep thinking guide. It's a book of all of the sort of the resources that we've compiled to sort of help people in that vein be able to see all of the resources that we've produced. We provide an overview of Parents' Night Out and its purpose, of course, as a part of that facilitator's guide. Some of the best practices for virtual and in-person sessions, including using Zoom and some of the rest of that. Some considerations for planning, logistics, and promotion tips, as well as the detailed presentation guidance options and customization for that. Now, we'll see if the next one works. I'm hoping that that'll be the case. If not, I will grab the link and see if okay, looks like we're going to go.
Are you prepared for the most important conversations you'll ever have? Everyday moments are great times to talk with your kids about underage drinking and other drug use, because talking early and often lets them know your expectations, reinforces your message over time, and promotes ongoing open dialogue instead of just one big talk. But what do you say? And how do you say it? The Talk They Hear You mobile app is your guide to get informed, be prepared, and take action to talk with your kids about underage drinking and other drug use. The app is designed for parents and other caregivers, educators, and community members who play important roles in children's lives, like coaches, faith leaders, and others. The app provides guidance for talking with kids in a range of situations so that you can be prepared to talk about underage drinking and other drug use when opportunities arise. For each different scenario, the app helps you set a goal and gives you suggestions for how to start the conversation with your child. And it also helps you anticipate what your kid might say when you bring up these subjects, helping you plan responses in advance to keep the conversation on track. When you're ready, the app lets you practice and record yourself so that you can review what you said and make adjustments if needed. Remember, talking about underage drinking and other drug use works best when it happens naturally in everyday conversation, so practice several different situations. The app also puts additional resources at your fingertips, useful information about alcohol and other drugs, and how to help your child stay safe. So download the Talk They Hear You mobile app today from the App Store, Google Play, or Microsoft Store, and see how easy it can be to talk with your kids about underage drinking and other drug use. Because when you talk, they hear you.
And I'm hoping that that came through well for everybody. All right, let's see if we can. So as I spoke to you a little bit earlier, and as the video had illustrated, the app is really designed to be highly interactive and engaging that way, so that you could really practice. But we've also done a little work on gamification. You know, many of us like to be, I'll just call it mildly entertained as we're doing some of this work. So we've added some features in there that allow you to share in your social feed, whether that's Facebook, Twitter, whatever social feed you have, but also to get some achievement badges and to do some work that way. So you can share your successes and the work that you're doing. It'll also help send some reminders for you, like let's schedule that conversation with my child. So it has a feature in there that you can schedule the talk with your child on multiple days. We highly recommend that as you're going forward. So the conversation starters, it builds out, and we will be building out some new pieces with this today, but the conversation starters and goals, keep in mind sort of the possible reactions for children, help you develop some conversation closers, how to sort of end that conversation in a positive way. And of course, facts on underage drinking, and then earning badges, which I had spoke to a little bit earlier. We talked a little bit about the practice conversation and the listen back. It's important to note that all of this information is really held only on your phone. It's not shared with anybody else. Any conversation, anything that's recorded, any information about you, the only thing we'll actually know is that there was a user and they went to this scenario. And really the goal here is we've developed this all about scenarios so that you could look at whether it's dinner time or something along those lines and get information around that, and then practice that during prior to having that conversation. All right, well, let me add in Erin here to talk a little bit about True North, their implementation of things, a little bit about their program and what they're doing in Washington State in a number of ways that way, and then how Parent Night Out and some of the other work fits into all of that. So Erin?
Good morning or afternoon, where you guys are. Yeah, so I mentioned earlier that we operate a fully licensed behavioral health clinic within our range of services. And I'm sorry, there's actually sun shining in Washington right now. It's coming in the side. So we provide services throughout our region, prevention through recovery support. So we have multiple funding sources, and it really just depends on the grants or managed care organization contracts in which we operate what services in which districts. The beauty of our partnerships is that it allows us to enhance all of the different services that we create throughout our system. Prevention services is something that we have really worked hard to embed systematically throughout our region. We have a behavioral health navigator who provides comprehensive supports throughout our region for helping families and school districts identify resources for those particular families that may need service, who may not be able to access otherwise. And then, of course, we mentioned that we do provide school-based behavioral health care. We have clinics in all 5 of our counties that we serve, but we actually have staff embedded in school districts. We rely on our community partners and other treatment agencies to help us to deploy services best for the region. Through our parent partnerships with our school districts, we've been, like I had mentioned, pushing out Parent Night Out, as well as other community services that parents may need to know or want to hear about. In our implementation with Parent Night Out, we are looking now at trying to identify different times that parents may be more available instead of the evening hour. So we're going to host a lunchtime Parent Night Out, potentially a morning Parent Night Out. So we're trying to really figure out how to get connected with the sporting teams and those types of things. So the parent nights for that, how do we embed and partner with some of our other resources? So with that, I will turn it over to, I think, Deb. Oh, it's a video. Okay, let's see if this works. I was loading it on my computer, so hopefully our video works. This highlights some of the local services that we do in one of our school districts in Hoquiam, Washington.
Yeah, the first time I met Izzy was in middle school. He just came down for the day, just to introduce himself, played some games that were, drug prevention oriented and behavior or conduct related. It was the first time I met Izzy.
30 years ago, there weren't places or people to go to support students. There weren't systems in place to do that. We didn't have the resources. It's changed how I do my job. I'm more effective, and I'm more effective because I can partner with people. And when I partner with Izzy Chavez, it kind of comes together magically.
We got the opportunity to have the student assistance program, a person that came out to our school, and his name is Izzy Chavez, and fortunate for the Grizzlies that he was a former student, built a good relationship, had that relationship here, was passionate about making a difference in Hoquiam.
The role that I've been able to have here has been great. So going from doing classroom presentations, doing universal services, awareness projects that are to all students between the middle school and the high school, letting them know that this is important, trying to reduce stigma around substances, bringing awareness to some of those issues that our community and our schools are facing.
I can think about specific phone calls I've gotten from parents, and the parents in crisis, and they're talking through the situation, and it starts to emerge the issue, and what the issue is for the family is around concerns with drug or alcohol use for their student. And I just instantly know that I have something really substantial to offer them.
They come to me with questions, and being able to be in classrooms and getting familiar with students, they have felt more comfortable coming to me as opposed to other programs that have staff that will either just come to the school or being referred to an outside agency, somebody that's not connected to the school.
Izzy was, and the True North program was the key to helping me and my kid. That was the start of a process that opened my eyes to the need for services in this area and the need for help.
As Izzy creates that relationship with the students, they respect what he has to say, they listen to what he has to say, he helps challenge their beliefs, he helps introduce them to other choices they could be making.
Meeting students where they're at and their physical location has been huge.
He works with clubs, he works with students that really have a huge need, and that might be in treatment, outpatient treatment, things like that.
Izzy helped me get him into a residential treatment program, get him totally off of any drugs he was doing.
Students that have worked with Izzy their attendance has gone up. We've had improvements in grades. So really it molds well because there's students that need those supports, but also they're interacting more with school in a positive way.
It's this really seamless process that from the outside would look magical. From the inside, we know it's really intentional, and it's about putting that time in and finding all the places where Izzy can be in our campus. And I can't think of a place where he isn't.
Students start to get familiar with me. I make jokes and stuff in their classroom presentations, try to make it fun. Sometimes they're dealing with really serious issues and have no one else to talk to, that nobody else is bringing up some of these issues around substances and mental health. So they feel a little bit more comfortable coming to me.
It took time. And the other services that went with it, the meetings, just the keeping my kid involved in school. I'm not sure he would have stayed in school without somebody like Izzy to talk to at school.
Sometimes when you come out of substance use, it's hard because your friends may still be using, some of the people that you hung out with are still using. So this kind of puts them into a group where they get to meet new people. They have activities to do, so there's that belonging. I'm part of something.
Once you show them that you're an easy person to talk to, once you show them that you're a support for them, that they're more comfortable coming to you.
There were times when I just said, well, at least go in and talk to Izzy. oh, okay, I'll at least do that. I mean, it was that basic a thing. It was that basic a hook, essential hook to keeping him going. It just was.
When someone is asking specifically around support for drug and alcohol, whether it's a parent or a student, and I'm so excited because I think, oh my gosh, your life is about to change. I'm going to introduce you to somebody and you're going to build a relationship. You're going to get strategies. You're going to get support that you need and deserve. And it won't be overnight, but it's going to start to look so different. It's going to feel different for you.
It's such a critical piece, but it's like all community health services. It's always fighting for funding, always.
I assumed every school had something like this, and I didn't know that it was different in other places, but we're fortunate to have this situation in Oakland. I think of little pockets of successes because that's kind of how you have to see it, because each kid's different. It's really trying to meet the needs of each individual student, and to have Izzy here doing that to help support that mission is invaluable. Seeing students that are so low at times, they change their lives. I mean, that's always the thing. Like, it's always my favorite thing at graduation is you see that kid that crosses the stage. I mean, they didn't see themselves there. They made it.
It's a really good thing having Izzy at the school, because, you know, just talking to somebody could turn it all around.
Thank you for watching our video. It still makes me a little teary to share that work that we have been doing with Hoquiam for quite a while. That is not an overnight thing that just happens with grant funding. That is 8 to 9 years of really intentional collaboration and work with the school and the community and our staff. And staff is critical, right? We all know it's tough to find workforce. And so, you know, I think we were really lucky because Izzy also went to school in Hoquiam and then went away to college and came back and, you know, is really an embedded part of that community. Hopefully you were able to pull out some of the pieces in which we deploy services in school districts. I think probably the biggest message is relationship. And you build relationship through that tier 1 school-wide practices. Having our staff people be out in buildings, out accessible, building that safety net and zone for kids so that they know if they need support or they need something, they know where to go to find that. You heard the parents say that sometimes he was really struggling with getting his child to school, and he would use Izzy often as just go check in with Izzy. And then as you know, if you check in with him and you want to come home, I'll come get you. And all the time he would check in with Izzy. He'd set his day up for success and he'd have a successful day. And so that's the power of prevention, and that tier 1 service is really creating those partnerships, having staff know where to send students when they're having struggles. Of course, then the targeted interventions. So we do a wide range of targeted interventions within our system of care. And then of course we do have the treatment services. So if you have a substance use disorder or mental health disorder, then you also can access those treatment services in the school if you would like to, or we will find a way to partner to get you those services in the community. Slide.
Oops, sorry about that.
Oh, that's okay. And so this is a little more information. You can't really see it on the screen, but it is in the PowerPoint. I think it's just helpful to have in there. It really drills down on what we're talking about within those tiers and some ideas of who the system of care partners and data decisions that we make are along the bottom, which you really can't see because I can't even see them, but they'll at least be in the presentation for you as a guide as you're thinking through how to build this thing. And I think the biggest message that I would leave you with is just start. You can start anywhere. You can just start with a parent night out session, right? And then build from there. Get the power and the funding through people being really interested and invested in this work, and build it out from there. So happy to answer questions at the end. Next slide.
And I think we're up with Debbie. So thank you, Erin, so much for that. And I just want to echo something that Erin said, is that you can start anywhere at any time. And I think as parents, caregivers, and community members, you know, I think it's the one thing you can do is lend your voice to trying to get these services in your schools and in your community to focus on children. Debbie, would you talk to us a little bit about Parent Movement 2.0 and some of the work that you're doing?
Sure. Thank you so much. So Parent Movement 2.0 is there to help parents help their kids navigate away from marijuana, alcohol, nicotine, and other drugs, predominantly through education. And it is mirrored or built after really what was considered Parent Movement 1.0, which was an organization and a collection of organizations from 1979 to 1992, when we had serious alcohol use among our high school kids, as well as a really significant marijuana use problem at that time. And we also had head shops and things like that opening up. And in fact, that organization is considered the reason why drug use among high school seniors dropped by 66% over that time frame. So they were very effective. And one of the just basic principles of the organization was something called parent peer groups. And it was seriously just parents talking to each other. The power of that just cannot be underestimated or described significantly enough. So what helps in that situation, though, is that parents also have some information. And today, when we modernized some of those concepts, what we realized and what we know is that parents are extremely busy. It's kind of beyond comprehension for most parents. And if you actively have a high school child right now, and if you happen to have more than one child in school, it is just relentless. And the number of topics that a parent may be keeping an eye on is so broad today. You know, everything from internet gambling and eating disorders and substance use and online bullying and real life bullying and these number of real issues that are affecting our kids. Every manner of mental health concern is just really profound. So the fact that drugs and alcohol or youth use of substances might fall down that list of things that parents are watching or paying attention to is really rational. But we want to help parents keep the substances conversation or awareness in their top 5 things that they're watching. So because parents are so busy, we know that we have to target information very specifically to parents. So just general, platitudes about drug and alcohol use are really unhelpful for parents. They really need that information translated into why should they care. If we can focus on the benefits and outcomes that they can potentially receive or get, when we're creating that information and or promoting a program like Parent Night Out, that's usually really helpful as well. And when it comes to substance use, we know that most parents are parenting it from their own experience and what they know about high school use. And we want to expand that for a lot of reasons. But one of those reasons is because there's so much we know now about substance use and about the teenage brain and about, adult addiction being seen as a childhood onset disease. There's just a lot of new thinking. So Parent Night Out, as it says here, is perfectly designed as a first step towards that. It brings the awareness of this discussion up. It offers techniques for these uncomfortable conversations. But as everyone has said today, these uncomfortable conversations are so critical to youth prevention. And then just basically that Parent Night Out comes out of the Talk They Hear You tools, makes it connected to all of them and provides that next step and that next layer and that next conversation, a wide variety of tools to kind of keep that conversation going. So next slide. And this is just a finish for Parent Movement 2.0. Our kind of centralizing concept is that we want a substance-free childhood for our kids and their friends. And we have newsletters and websites and emails and some social media that's just started. And please feel free to continue to be in conversation with us and connected to us as well. Yeah, and that's it. Thank you.
And thank you so much, Debbie. I'll put the placard up here and hold this for while we do our questions and answer period. We've got a little more than 30 minutes. We tried to keep our part of this conversation to that period so that we could answer questions either via the chat, or you can open your lines and just, if you'll just use the Zoom protocol, raise your hand and we'll try to answer your questions as we go. But, you know, for more information on Talk They Hear You, you can go to either underagedrinking.samhsa.gov. We've recently secured a new URL that I put in the chat, which is the talktheyhearyou.samhsa.gov. So you can get it either way. And then if you're interested in signing up for our ongoing monthly newsletters, you can do that at the URL that's listed there as well. And we'll make sure and try to put those in the chat before the end of the session here. So now let me just open it up to everybody for questions and answers. And we will go from there. So, I think one of the first questions I see is, how do you get parent involvement? Which is literally one of the best questions, and a question I think we've all heard probably many times through the course. And I think that is coming from Debbie Allen. So Erin, Debbie, do you want to lead off with part of that?
Go ahead.
I'm
Erin.
happy to start. That is a great question. I would love to know. It's so individual for each community and building and relationship. And so, but yeah, so as you heard, kind of like us wondering if we should try to do a noon hour type of situation, like what times work. So surveying parents to find out kind of things that they do. I know that in some of our communities, we stay away from certain days due to like work events or community events that are already pre-scheduled, or we try to partner and push that information out within those particular events. And again, really just inviting parents to things like Parent Night Out that are very small, kind of 45-minute to an hour sessions are a lot of times helpful in having them kind of get themselves attached to a bigger and more robust long-term program, right? Because again, we've done all types of family sessions in the past, and we've, you know, hosted meals, and back when we could host meals, things like that. And again, so I think it really is just really strategizing with your team and your community to really make it important and worthwhile to those particular families that are attending.
I would add to that, you know, I come from more of the school, just lay parent mindset. So, you know, we find that there is a parent education committee lots of times at a district level or at a school level. It might be associated with the PTA, it might be associated with the parent club, and to, you know, make sure that committee knows that we have these subject matter offerings around substances can be important and can be an avenue for getting something like a parent ed night structured. When I talk to some of my parent friends, you know, when we can do that, you know, then the question becomes, how do we get that parent in the community that's always throwing those parties or letting those kids have those parties show up to one of these nights? And that's tricky, right? You know, lots of times it's the choir that shows up to these events because they believe in this topic versus the people that really need to hear it. But what we trust is that in some cases, the personal invitation to those strategic members of the community can get them to an event like this, or we trust that the information will ripple out to more families and people in the community that need to hear it once we start the conversation with at least some parents.
Thank you, Debbie, Erin. And we have another question here from D. Martinez. So if you'd like to unmute your mic and go ahead and ask your question.
Yes, hi. Can you all hear me?
We can hear you perfectly.
Excellent. So in terms of the parent night out, what I'm understanding is that we can kind of try to do that at any point is what I heard. Here in Michigan, I work for a community mental health agency with a parent organization as well. And they do some work around some kind of parenting groups and also groups for young people. And I'm thinking this would be a great way of sort of also including our community. Are there kits or anything to kind of help us structure the parent night out?
There is a facilitator's guide and then a bit of a toolkit. And if you go to the Talk to Hear You website, we actually have sort of what I refer to as sort of the community toolkit that's on there as well. Our product guide, and I apologize, that's what I was trying to say earlier and I just couldn't get the words out. We have a product guide that actually lists all of the products that are made for the campaign. And one of those is the toolkit, including how to do social media and intervals. If you sign up for the newsletter, that it's the HTTP EEP URL. It's part of our MailChimp delivery, which is why it has such an odd URL. We actually once a month send out pre-crafted social media, both for the campaign and for the Parent Night Out piece. So those are all things that are available to you.
Now, my last question, is this also available in other languages like Spanish?
We do. We have a version. We haven't translated Parent Night Out, so particularly just yet, but we have Habla Ellos Escuchen, which is part of the campaign. And we will be, this upcoming year, we'll be doing more translation. I would also say, if you choose to use this and you're bilingual and you translate, if you're willing to share, we would be willing to pass it along to other folks. What we don't have is we're a small, we're like so many of these things. We have a small budget and a lot to do. So we don't get quite everything we need, but we will enlist and ask for any help that we can get, because if somebody's taken the time to do that, we certainly want to share and then make sure and include all of your information, of course, so we can give you credit.
Sure. Thank you so much.
And Debbie, I see you have a question as well, so please feel free to unmute your mic. Debbie Allen, sorry about that.
I do. It was just to let you guys know, how do you approach parents when it's an elementary, middle school that is starting to let parents know that there's a substance abuse starting in the school, or you hear it from your kids? It's like, this isn't a high school problem right now. This is an elementary, middle school problem. So how do you handle it that way through parents?
Well, I think Erin is still on with us. If she is, I'll let her lead off. If not, Debbie, you can go, and then I'll follow up with my comments on that.
I am on here. I don't see myself on the video screen though, but
There
I
you
did
go.
have a
I
little
see you now.
bump in internet. Okay. Yeah, one of the things is we tried to not be fear-based, right? That this is a huge issue in elementary schools, or this is a huge issue, but really encouraging our families and our school communities to think through good comprehensive prevention services, right? This is great information that every family should know, whether there's an issue or not in those buildings, right? These are preventative in nature and not reactive in nature. So I think coming at it from that context, that this is really great information that all families should have. Let's start a conversation is the best way. For us, and of course, I mean, we're seeing mental health and substance abuse issues across the spectrum of adolescents. And adults, right? And so, again, really trying to just embed with facts with the data that we know as it's emerging, and really having that comprehensive prevention framework background.
Yeah, because the reason why I was asking, because it was actually told by one of my children who's in 8th grade that a classmate of theirs was in class vaping. So it's a concern of mine. It's a concern of mine that I would like more parents to be involved and help the school out, reach the parents, because this is beginning to be a problem. And I don't like that. My kids don't do it. Not saying that they probably won't when they get older, but I want the education to be there now that they're younger.
I would just add to that, in our local area, 2 things. One, the vaping in the bathroom is really kind of what started our community willingness to look at this topic and to have a conversation about it. I would recommend letting your principal know that you have heard this and seen this. And sometimes that can be a motivator for administration to get involved and to become more proactive. And then the last, and sometimes not. I mean, I think I saw somewhere in the chat where the question was, what do we do if our administration doesn't want to believe there's a problem, which that is still shockingly common out there. So, but sometimes it does get the ball rolling, and administrations have to deal with a lot of things. And so just like with parents, substance use can fall down that priority list. And when parents go to administration and say, I'm worried about X, Y, or Z, that can be just a powerful motivator to move it back up the priority list. And then just the last thing I would say, and it depends on who you are as a parent, or if there is a parent in the community that is just particularly hot about this topic and just one of those influencer type people, I have seen parents kind of take it upon themselves to start the conversation and just reach out to their friends and be like, okay, I've had enough of this. And not that we've seen it happen, but a parent could pull down the parent night out materials and actually deliver the parent night out in their living room if they were so inclined. So it's kind of grandiose, and I don't see it happening tomorrow, but it is something that is functionally possible.
Yeah, because it bothers me when they can get away with doing it in class. So that's what's bothering me, and that's why I wanted to take this this training right here, because I want to educate my kids at school.
Well, and so Debbie, I would add to that, persistence pays off, and while I think to Debbie Berndt's point, sometimes because of the prioritization and all of the, I hate to say it, sort of hair on fire days that many administrators have, where there's just a lot of problems to sort through on that particular day, it's important to not just go, the same reason we would tell you not to just have one conversation with your child. It's important to keep engaged. It's important to have multiples. It's also important to raise it as a community issue. And I can promise you as a former K-12 administrator that when 4, 5, or 6 parents show up on my doorstep and they say things like, Mr. Vincent, there's a problem and we need you to hear us. And when they show up to school board meetings and they say things like, Mrs. Wick, we need you to hear us, it gets the attention. It may not happen right away, but I promise you, this is the power of community and this is the power of parents. And so you find your voice and feel free to exercise it. I don't see this issue getting easier for any of us as availability and access has increased many times over in recent years. And so I'm very concerned about our kids. The age is going down in terms of—
Yes. Well, I thank all 3 of you very much. I loved this session and I really learned a lot. And I look forward to sharing the PowerPoint with my kids at school.
You're welcome. You know, I wanted to comment, there's a couple of other questions that I just wanted to make sure, because you could walk away from this thinking that it's only underage drinking. There are materials for both vaping, prescription drug abuse, marijuana that have been made as a part of Talk They Hear You as well. So while our focus is built out of the STOP Act, the Sober Truth on Preventing Underage Drinking, and that is the preponderance of our funding, the agency, SAMHSA, had felt compelled to add additional money to make sure that we broaden that message a little bit, because we know that children don't just drink alcohol. They tend to be engaged in a lot of things when they're in that developmental phase of growing up and experimenting and trying to find, you know, looking for sensation. I shouldn't say it quite that way, but, you know, they're often looking at it in that frame. So with that, just be aware that that is out there and occurs. So do we have any other questions that I can answer or we can answer for you?
Rob, there was a question in the chat about international information.
Yes, I see it.
And I don't know, do we, I mean, this information is certainly applicable in any country and could be used by any country. I don't know, do we have international data around underage substance use?
There is international data. I can point you, if you go to the World Health Organization or the Pan American Health Organization. The Pan American Health Organization is primarily focused on Latin America. The World Health Organization is really focused primarily, well, it's completely international, meaning, you know, Asia, Europe, etc. But there is data on that, in particular on Germany, with a lot of the European studies. I don't have it in front of me, of course. You know, we're the domestic side of the equation, so my colleagues that participate in what is known as PEPFAR, which is the international group, would be better able to answer that. But I work very closely with Dr. Ralph Hinkson, excuse me, who is the person that actually leads the international piece for WHO on the data collection. And I know there's great data on this particular piece. I also saw another one. How would you handle a school district that is hesitant to participate because they don't want to be the school? They don't want the school community to think that they have an issue with substance use. And while we answered part of that question, I want to circle back to that a little bit because I think there are a lot of things that parents and community can do in this particular vein that are quite helpful. But I want you to first start off thinking, so when any of us, and I'll just classify us all as adults and parents for a second, when any of us are looking to move into a new community, let me just ask you, what's the first thing you usually do when you have a school-age child? And that usually tends to be like, well, what school is my kid going to go to? And is that a good school, right? Is there an issue that I should be concerned with? And so for schools, that does tend to be the lens they look at the world. So I would invite you to think about how we approach schools in that conversation. And Washington State, but other states, California, where Debbie's at, Maryland, where I'm at currently, you know, they all have usually state surveys that they do in their schools. The important part of this is one, participate in those, be aware of that information. But I think it's also important to help schools understand you're not the only school in America that's dealing. There are 131,000 schools across America, about 76 million children on any given year that go to school. Every school in America actually has a drug problem and an alcohol problem. Now, the question is not whether they have the problem. The question is what they're doing about the problem. And it's not that the entire school district is a drug school, because that is never really the case. There are children growing up. Every year there are new children going to new schools. And some of those children, as a part of their growing up, become exposed to substance use, drugs or alcohol, and engage in it in some form or fashion. The real question is the message, and how do we help schools, one, feel safe to say, you know, it really is important that you participate in this. It's really important that you engage and address these issues, not because we're trying to take you down as a school, but because we want to help you be successful. And because it's my child, and I want my child to be healthy and well, while they're attending school and not exposed to things that aren't particularly useful or helpful. And to your point, I think Debbie Allen, when you had talked a little bit about, and I think Ms. Martinez had said similar, showing up to that conversation, being an ally is sometimes the best way to get schools to start to address the issue. No, none of us, and I would invite any of us to think, when one of us has, you know, we'll just say that little piece of lettuce on our teeth in that conversation when we're at lunch, and it's only a good friend that says, you know, Rob, you might want to take care of that. It's a little distracting. When it comes from that place, I'm more likely not to be as embarrassed. I'm still going to be embarrassed, of course, but I'm less likely to be as embarrassed and more likely to do something, right? As opposed to when we sort of shame and strain. And it's the same thing I would tell schools about parents. The last thing we should ever do is shame and strain a parent who's having a problem with their child who's using substances. What we should be doing is help facilitating that child to getting good care and resolving the issue. And that could be a much longer period than sometimes any of us like, meaning that it may be 1, 3, 4, 5 years before we actually resolve the issue, which is all the more reason it's important organizations like Erin's and Debbie's are there to sort of come alongside and support schools. But I would also invite the National Federation of Families and all the other organizations that sort of have an investment or a stakeholder here, because it really is not any one of us, it's all of us that matter in that conversation. Other questions or thoughts, comments? We're certainly open to all of the above. And I know we're just about time, so.
Hi, I did have a question. What about either parents or caregivers or youth or teens who have, I don't know, some sort of cognitive or verbal or developmental, you know, condition that maybe language or even a youth's understanding of social situations might be challenged or impaired in some way?
Well, I will just start it off to say we know those children are most at risk in many cases, depending on the circumstance. But I also know that Erin and Debbie both have some thoughts on this, just as we've had very similar conversations off and on. So Erin, I don't know if you want to start, or Debbie, I'll leave it to the two of you.
Erin, you go ahead.
Well, I think that, like Rob said, it's even more important to have those conversations, and frequently, right? More often. And then from those conversations, it's going to help you kind of understand which direction you need to go with the students and how to access some other supports for them potentially. So, but I wouldn't like vary away from having the conversation because of those situations. I think I'd have it in more small chunks with those kids more frequently. I know those kids personally.
I agree. I don't have much more to add. Thank you.
Well, and you know, I think this is also, especially for somebody who's on a 504 plan or part of IDEA, I think this is also where you get an opportunity to work with the school to say, I want to make sure that certain things are there as it relates to my child's education and part of their 504 plan. And while, you know, I know any parent who's had to work with the school district on that, you know, there's lots of stories around all of that, but, you know, persistence pays off. And while it's difficult, it is really, really important that you show up for that conversation and help them understand. And, you know, again, you know, I would just say it's how we approach these conversations, I think, matters. When I come at the school administration sort of very angry, it's not always as helpful. It tends to shut the conversation down. Same way I would say that if we're having a conversation with our child around use, and let's just say they felt comfortable enough to say, Mom, you know, Ms. Hernandez, I'll apply this to this situation. You know, Mom, today somebody offered me marijuana and I tried it. And of course, you know, most parents' natural reaction is that fear and panic and, oh my God, and probably elevated voice and, you know, all of that stuff that sort of comes out at that moment where you're not quite prepared. But I think it's more helpful when we approach it, you know, the old adage, you know, honey gets more flies, right? I think when we come at it from that perspective, to let me help you understand why this is important for me and my child, and why it's also important for you as a school, because if your job is to educate my child, then you could be the best educator on the planet. But if that child's not available for your good instruction as a result of using substances, then the likelihood of you accomplishing your mission and achieving your goals is lessened by us not addressing this issue.
I think one other thing with, you know, with helping bring school districts on board is, you know, assume good intentions. Our districts are working really hard, especially now with the pandemic. There are a lot of things coming at them. And so when you are communicating with the school district, really coming with that, you know, that I care about our community as well. I want to partner with you in this. Here's some things I've been thinking about. Here's some solutions. I was at this conference last week and there's this parent night out. I'd be happy to help you coordinate that. Is it something that we can help with? So really trying to find the ways to be, and I get that, you know, some districts may not want that type of information and there may be challenges, but again, it's that 7 times 7 ways and really coming with the solution focused and not just more of that, like, well, you haven't done anything and my child is now seeing this, and, you know, but really trying to have a productive conversation. I think really, like Rob was saying, just will help with that communication and probably go a long ways.
And I know we are just nearly out of time, so I want to just do the lightning round here on any other questions to make sure we give everybody a chance to ask a question or offer a comment.
This is Mrs. Hernandez. You did answer it when it came to the marijuana thing, because in our area we have a lot of complaints from parents about the not just the vaping but the marijuana smell coming within the classroom. We have allergies with kids. So you kind of answered that one for me. Thank you.
Well, and I would just invite you, Ms. Hernandez, that, you know, I think the conversation on cannabis and marijuana, on how, as we're changing the laws across America in a variety of ways, I think this is the time more than ever for parents to be involved, and what those policies and laws look like in your community, in your state. You know, at the end of the day, all of those things become, it's your community in your state, and, you know, it's the democratic process, right? So, you know, I would tell you to make sure that you participate in that process and be a partner and communicate the things that are important, certainly to you, for the protection and health of your child and your community.
Rob, I would add to that, just a tiny bit of background, is the Parent Movement 2.0 information started in marijuana. So if you are on the website, you're going to see a lot of information about marijuana, THC, that helps everyone have a more reasonable conversation, because like you said, this is a very emotional, heated, aggressive topic that is kind of sweeping across our country in all kinds of ways, everything from political legalization type discussions to just social media encouragement and, you know, better living through chemistry kind of conversations. So the more we know about that particular drug, the more rational a conversation we can have. And it was the last question about kind of developmental delays. The one thing that did cross my mind is there's a lot of misinformation and anecdotal information out there about a substance like cannabis or marijuana being really good for some cognitive and developmental delays. You see a lot of it around ADHD, and we know so much about the harms of cannabis relative to all developmental delays, and specifically ADHD. It is a really toxic partner. So, if those types of conversations are bubbling up in the community, to the extent that you can direct community members and administrators to different and better information along those lines, that can be a strategy as well.
All right, I think we've got time for one last question. Should we have one? All right, ladies and gentlemen, I would just say thank you very much for taking time to participate in our workshop today. I could never thank Debbie and Erin enough as being great partners with us here at SAMHSA. I could actually never thank all of the parents and caregivers who are part of these sessions for taking time to be present for your child and do the hard work. I know in 2021, being a parent is not an easy proposition. I'm not sure it ever was, but it does seem in modern living, it's gotten a little more complex. As a grandfather of two amazing young women, we worry every day about those futures and hope for each of you to participate, become more educated, find your voices, find your passion and your energy, suit up, show up and participate, because every voice counts. What's at stake literally is the success of each of these children. And I'm a firm believer that, the community and every adult has a responsibility as we all participate in the growth and development of children in some form or fashion. So with that, I thank each and every one of you, and we will conclude our remarks. And please have a great day and please be safe.